For me, when I look at aging on the appearance of the skin. And typically, I look at five main causes of aging of the skin. So those causes would be nutrient depletion, collagen degradation, inflammation, oxidation or free radical production, and the buildup of cellular waste.
Mm.
Now, those are things that you can see. These are things that you can see in the aging process. There's also a lot of stuff going on underneath the surface.
Dr. Tony Youn, I'm so excited to have you on the Dr. Tina show today. I have been a big fan, truly, for
Oh,
years and years,
oh,
and
thank you.
I have not got to connect with you, but you recently sent me your upcoming book, Younger for Life, and I read through it. I love it. I'm very excited to
Oh,
have you
thank
on the
you.
Dr. Tina show.
Well, I am so excited to be on. I too have been following you for a long time, and I don't know how our paths haven't technically crossed because we have a lot of common friends and everything.
I know we kind of run in some of the same crowds, and I always
Yeah,
see you everywhere, but I don't know. I just never got
yeah.
to talk to you. So here we are.
Well, this is a real honor and a privilege, so I appreciate you having me on.
Thank you. Well, I've got to tell you, your TikTok and your YouTube bring me so much joy. You have a ridiculously huge following, but you're so freaking funny and
Oh, thank you.
just genuine and great, and you give really valuable information. So I don't know, I just love the heck out of it, and I'm
Oh, thank you.
yeah, excited to have you on today. So we're going to talk about the book because off air we were chatting about you're a plastic surgeon, you're a holistic plastic surgeon. I
Hmm.
admittedly, when I first heard about you, I was like, how is somebody a holistic plastic surgeon? So can you talk about that a little bit? Because I think it ties into the book really nicely.
Yeah, so I went through all traditional medical training. So I'm an MD. I did 3 years of general surgery residency. I did 2 years of plastics, and then I did a year of a fellowship out in Beverly Hills with the top name Beverly Hills plastic surgeon. And then I moved to Michigan. I started my own practice, and I was about 10, 12 years into practice, and I thought that I had honestly reached the pinnacle of success. When we look at surgery, we have this saying during our training to cut is to cure, or the only way to heal is with raw steel, essentially. And this idea of a cut first mentality. And, in plastic surgery, I used to gauge my success, honestly, in how many facelifts I had on my schedule. Because patients will choose sometimes almost anybody to do their lipo. But if they're choosing you to do their facelift, then you have reached the top of your field. And so for many years, that's kind of how I looked at success was how many facelifts did I have on the schedule? And then I had a patient who had a horrible, horrible complication after a facelift operation. And it absolutely sent me completely reeling. And it got me to a point where I even questioned whether I should quit medicine altogether. It made me wonder, am I doing the right thing for my patients when horrible things can happen? Now, it wasn't anything that I did or I could have changed or done anything. Just sometimes you go to surgery and bad things happen no matter how good your doctor is or how great your health is. And so it made me realize as I kind of hit rock bottom in my practice and I almost quit medicine altogether, that everything I was taught as far as the goal of being a surgeon is wrong. I was always taught that the goal of surgery of being a surgeon is to bring people to surgery. And I realized that my goal should be the exact opposite. It should be how do I keep people out of surgery, yet still help them feel and look their best? And that got me into looking into the works of a lot of our alternative medicine friends and practitioners. I started learning about all these different things that I was not taught in medical school or residency, like nutrition, like about clean skincare, like about all these lifestyle modifications and changes that you can make that can really turn back the clock naturally. And that became the basis of my new book, Younger for Life.
I love it. It's so true. What we were saying off the air that I was sharing is I always know something's wrong with my health when I start to
Mm-hmm.
look, things just start looking off. And it might be pore size, it might be puff, it might be hollowness, it might be discoloration. But if I have to put makeup on to go out, something is wrong with my health. And I realize
Mm-hmm.
I'm aging, but I have always used my skin as I know our mutual friend, Dr. Trevor Cates, she says, your
Yeah.
skin is your mirror to your internal
Yeah.
health. And it's so true. And that's where I love that combination of surgery, giving the patient what they need and want, but also I'm sure by you helping them improve their health overall, it probably makes huge differences in your outcomes, patient selection. I'm sure all of that plays in.
Yeah, and it's funny because we have a lot of colleagues who are in alternative medicine, and if you were to ask them, "What can I do to have beautiful, healthy, vibrant skin?" They're going to say, heal your gut because there's a gut skin axis. Heal your gut and your skin will be beautiful. If you ask a dermatologist, what do I do to get my skin looking young and healthy and youthful? They'll say, use sunscreen and use a retinoid. If you ask a plastic surgeon, they'll say, do Botox and get a facelift. And really, the truth is a true, I think, integrative approach is going to be your best option, your best bet to really looking and feeling your best, is that kind of inside outside combination. And as a plastic surgeon, I am fully committed to using plastic surgery only as a last resort. Because I do know, being realistic, some people say nobody should have plastic surgery, it's vain, you shouldn't do it. And the fact remains is that, yes, if somebody asks me what's the worst thing that can happen if I go into the knife, I'll say you can die. But there are but that's extremely, extremely unlikely. And there are many situations where really your only option is surgery. So, I see women who've had 4 children, they've got skin hanging from their tummy, they've got rashes and infections underneath that. There's no cream you're going to put on to make that skin go away. There's no food you can eat to do that or supplements. Really, in some cases, all you have is surgery. But nowadays, there's so many options that we have that can take the place of surgery, that maybe we would have gone to surgery 10 or 15 years ago. Now we don't have to, and we can do other things instead.
Well, and also, I have no issue with vanity. I mean, whatever somebody wants to do or not do with their body is their business, and it's not my business. And one of the things I was talking with my husband the other night was the extremely large amount of women in the like influencer health field that are online who have breast implants.
Yeah.
I think breast implants are bonkers, but that's just me because I pulled a set of breast implants out of my cadaver in chiropractic college and they were black and disgusting. And I was like, that's not a good idea. Let's not do that. But I'm sure that, and then now there's the breast implant illness is finally coming out, but I'm sure there's shades in the middle. Everything's so polarized and so extreme online, and everybody, oh my gosh, this is terrible. And they're purists about everything. I'm right in the middle. I'm like, let's use all the tools we got, do whatever you want. I don't care if somebody has breast implants or not. I don't care if somebody wants to get a facelift or not. I will say though, as somebody who did regenerative medicine for over a decade plus, and I know this, tissue integrity is everything. And when people eat poorly, their hormones are jacked up, their gut's inflamed, they're not in good health, their tissue integrity is garbage and it's friable and it falls apart. It just, things don't heal. Like they don't have any turgor in their tissues. And I'm sure it's got to translate to their face and other parts of their body, right? Like,
yeah, and it's true. When I first started my practice for many years, actually, people would ask me, okay, I'm going to have surgery. What should I do? Should I take any supplements? Should I eat something? And I honestly didn't know, but I didn't want to tell patients I didn't know. So I just said, go off all your supplements, don't smoke. And that's all they really taught us. Now, all of my patients I put on a pre and post-op supplement protocol. We make sure they get enough protein. We get them anti-inflammatories, and we put them on different supplements because we know that this can actually make a big difference. But the problem with traditional medicine is that we're not taught anything about nutrition and especially supplements. There's so many doctors who are anti-supplements, and there's so much good that taking supplements can do. And so, yeah, I 100% agree with you. I think that the best approach is the true integrative approach to this. The interesting thing too, and you mentioned vanity, vanity actually can be a good thing in some situations. I get patients who come to see me and I instruct them like, look, you need to make these lifestyle changes. You got to get off smoking. You got to change your diet. You got to get more active. And they're like, no. I go, well, you could get emphysema. You could have a heart attack. No. I go, well, your skin can sag and you can get wrinkles prematurely. They go, oh, wait a minute here. Well, if that's the case, then let me make some changes.
Yep.
So, it's speaking to people where they are and finding out what their motivations are. And if we can help them become healthier by, appealing to those motivations that may be different for some people than others, then that's a service that we're doing.
I totally agree. And again, like who cares if somebody wants to get all the work done in the world? Obviously we don't want to give into people's pathology where they overdo it, but yeah, if somebody wants to look younger and they want to have some surgical procedures done, shoot, I've been using Botox since I was in my early 30s preventatively. I'm all for it. I have no problem. And many of my followers get bent sideways when I talk about it. They're like, I can't believe you're promoting big pharma. And I'm like, yo, I'm fine with it. And there's actually really great data. This ties into what we're saying. There's great data that I've seen over the years and more has come out over the years that when people actually get their glabella injected and they're not, or even their frontalis, and they're not looking at such a grumpy face in the mirror, significant changes happen in their mood and their affect. And they've
Isn't that
taken,
interesting?
yeah, people who are severely depressed have,
Yeah.
had really, really profound benefits. I actually think, I'd love to hear your thoughts on this. I really think that the way the musculature moves feeds, so the actual contraction of certain muscles in our body, I believe, feeds back into our brain
Yeah.
to evoke an emotion. And so
Totally.
if you can't be it's not just how you look in the mirror. If you can't be scrunching them and contracting them, you're not going to get that negative emotion. And I don't
Well,
know. I'm all for the goodies.
and that has actually been proven. It's
Okay.
been proven that if you are in a bad mood and you smile, even though you don't feel like it, if you smile, then that actually has been proven to improve your mood. It's the same thing. There are studies, just like you said, where people get Botox and there's less amount of depression and emotional labileness. They don't really know why. I think it's exactly what you're saying. It's not that Botox does something to your brain. It basically is just, it doesn't allow you in some ways to make those facial expressions that are negative and that give you that negative feeling. And so, yeah, for your followers who are listening to this, if you're having a bad day, just try a little experiment, just try smiling. Force that smile, try smiling and see if that may help you feel just a little bit better. And I bet you it will. That's what the studies do appear to support.
I'm with you. We're Gen X, though. We smile at people, and people don't smile back anymore. It's very weird. I grew up smiling at everybody I walk down or walk past on the street, and it's like it's dying with our generation, Tony.
Well, I think part of it is that we're walking down the street, we're not necessarily looking at our phones the whole time. Like it's just a different time,
Yeah.
and I miss some of those times. But then whenever I talk to my kids who are teenagers about it, they roll their eyes. They're like, oh yeah, a long time. I mean, the crazy thing, Tina, is that, for us, we're in 2023 when this comes out, maybe 2024. And we look at, we grew up in the 80s and we think, okay, what are the 80s to today? That's like 40 years ago.
I
For us,
know.
like the 80s to the kids are like the 40s to us. And you can imagine how long ago that seemed to us when we were back there in the 80s thinking like,
Oh
geez,
my
that like
gosh.
was right after World War II was over.
That's crazy. I never thought of it that way. That's
Yeah,
wild.
we're as far away from the 80s as, the 1940s were to us when we grew up. So it's,
Ah, that's
yeah.
wild. I've got goosebumps from that. I've indoctrinated my daughter into all my 80s music. So when she's blasting Tears for Fears and Depeche Mode and all these bands with her friends are like, what are we listening to? What
The
is
kids
this?
actually they like the 80s stuff nowadays.
That's
I mean,
good. It's
it's
good
different. Like
music.
we would have we have never been like, hey, let's all hang out and listen to 40s music. But hey, the 80s are still cool. I mean, I get it.
Yeah, yeah. Well, you and I are young at heart. That's probably
Yes.
another big one. I think if you're young at heart, always, my husband is age appropriate, but up until him, most of the men I dated were younger. All my friends are
Hmm.
younger, generally speaking. I hang out with a younger cohort, and it really makes a difference when you're just surrounded with kind of a youthfulness. My dad always said, I was in my 20s. I remember it clearly. I graduated from undergrad and I started trying to be super adult all of a sudden. And he's like, honey, you have until your 50s to act like you're 50.
Yeah.
Just act like you're 20 something. Just enjoy it.
Well, and the interesting thing, and going back to a little of the vanity stuff, there was actually a twin study from Denmark where they compared identical twins and which one of the identical twins lived longer. And the one that actually looked younger typically lived longer than the one that looked older. Now, I don't know if that, is that causation? Is that correlation? We don't know, but definitely there is something to the whole idea of looking younger and potentially the fact that you look younger giving you more longevity.
Yes, yes. I think of the Golden Girls. Remember that show?
Oh,
Those women were they were portraying our age, which is
they were in the
wild.
50s. Yeah, yeah.
They were
That's
supposed
the
to be in
crazy
their
thing.
like
Yeah.
40s and 50s. I mean, some of them were supposed to be older, but generally speaking, that's, back when we were young, folks they looked much older when they finally, I mean, I thought 40 was like the kiss of death. I thought you were
They
over the
were,
hill.
yeah, like Blanche, Rue McClanahan was in her 50s at that time. It's like the same age that Jennifer Lopez is now.
Wow.
And so that just shows, we're talking about anti-aging and all that type of stuff. It does show how today, I don't think this is just makeup and stuff like that. I mean, people are living healthier lives. I think we have a lot more at our disposal when you look at diet, when you look at supplements, when you look at skincare. There's so much that are at our disposal that, yes, I mean, back when you're in your 50s, you could look like Blanche from Golden Girls back in the 80s, but now it's a whole different world. And it's exciting for people like our age and people older than us because you don't have to feel old as you get older because you look older.
Yes. Yes. I'm trying to stave it off at the pass. I mean, I'm trying to age intentionally with the best of
Yeah.
health and do it the most diplomatically I can. I'm not trying to look 25. You know, there's women really trying to hold on to their
Yeah.
youth. I'm not,
Yeah.
I did that in my 40s. I'm not as interested. I really just want to be the most beautiful 50 that I could possibly
Yeah.
be. And I want to be
Well,
agile and mobile and, you know, having fun and having good libido and having good friends and enjoying
yeah, the
life.
way I'd kind of describe it is that it's a blessing to get older because, I mean, what's the alternative?
Yeah.
But at the same time, have fun trying to fight it every step of the way because, you know what, why not? You know, and I think you can look at aging in a very healthy manner, yet still fight against it and still understand that you look in the mirror and you see things that you may not want to see. That's okay. And you can fight that. Obviously, for me, it's doing that in as healthy of a way as possible. Because yeah, there are people who overdo the plastic surgery. They end up getting scar tissue complications and stuff like that. And sometimes, you know, mentally, it can be very, you know, people can be put in a very difficult, dark place with
Yeah.
aging. And so, how do you age yet, you know, and be appreciative of that, yet still look in the mirror and say, hey, you know what? Today I'm going to undergo a Morpheus treatment, or I'm going to undergo, you know, in your situation, Botox, or I'm going to undergo a chemical peel, or get on these great skincare products and feel good about that, understanding that, yeah, I may not be happy with everything I see in the mirror, but that's okay.
That's okay. Yeah. We got to accept what we got, but we definitely can take as many measures as possible to make sure that, you know, we're slowing down the process. Speaking
Exactly.
of, you have a chapter in your book that I think it's titled, What is Aging? What is aging and why do we age? Let's explain that for the followers.
So this is something that there's a lot of different theories out there of aging, and nobody really can put their finger and say this is the only reason why we age. There are anti-aging researchers out there that write, you know, 400 or 500 page books just on why we age and how you can increase your longevity. You know, for me, when I look at aging on the appearance of the skin, and typically I look at 5 main causes of aging of the skin. So those causes would be nutrient depletion, collagen degradation, inflammation, oxidation or free radical production, and the buildup of cellular waste.
Mm.
Now, those are things that you can see. These are things that you can see in the aging process. There's also a lot of stuff going on underneath the surface, you know, and a lot of various theories of why we age in general. You know, some of these things like oxidation and free radicals, at one time, people thought that was the reason why we got older. Some people thought that it was our telomeres getting shorter as we get older, and that's why we get older. Now people are talking about things like sirtuins and other types of aging factors and proteins that have a part into it. In the end, you know, does it really matter as a listener of a program like this on the cellular basis of why age, or is it more important of like, what can you actually do to turn that back? And I think that that is where I try to go, is these actionable things, you know, because we can talk about telomeres and the shortening of telomeres, but we don't know, once again, is that a cause or is
Right.
that, you know, a correlation? We don't know.
Yep. I totally agree with you. I smoked for 10 years straight, a pack a day from 14. Yeah, I know. From 14 to 24. I was a little chimney and I took shit care of myself. I lived off Snapple and Sun Chips.
Mm,
I was a mac and cheeseitarian, got no protein, was a complete train wreck of health,
yeah.
anxious, panic attacks, underweight, sick all the time. I mean, I was a mess. My followers have heard the story, but I am shocked. I am true testament to what you just said, because I should look like I'm a million years old and I get complimented on my skin all the time. And I'm like, are you
Yeah.
kidding me? Do you have any idea? I took antibiotics literally from the time I was born, almost constantly from the time I was born until I was in my late teens, early 20s. That is how sick I was. And just mismanaged. Right. And I'm like, lady, people say, oh, there's no hope. You're so lucky. And I'm like, yo, this is truly the rebuild of just good living, you know, clean
But you
living.
know, as a regenerative physician, that our body has a lot of power to regenerate itself. You know, and
Yeah.
that's kind of this one of the terms that is in my book called Auto-Juvenation. Really, that's this thing that I believe in, that the body has innate regenerative abilities to rejuvenate itself. You just have to give it the right tools for it to do that. Now, once again, this is all, on a realistic level. Once again, there's nothing your body can do to get rid of skin hanging from your tummy, but there's so many things that your body can do if you give it the right environment and the right nutrients. And if you try some things that we have technologically wise to help turn back the clock. And that's just such an exciting part of today. I'm not surprised that you have fantastic skin now because you have given your body the ability to get there. It's even as, you mentioned earlier that you were a smoker. As a surgeon, one of the big things I do is I do not operate on smokers. Yep. However, if you take a smoker and you get them off of cigarettes, even if they're like a 20-year smoker, 1 pack a day, 20 years, and you get them off cigarettes for 4 to 6 weeks, those patients, their tissues rebound, the vascularity, the blood supply rebounds in just 4 to 6 weeks to the point where it's typically safe to operate on them. It doesn't matter in some ways how long they've been smoking. You get them off that for that 4 to 6 week period, your body wants to heal. Your body wants to regenerate itself and has that ability. Once again, you just have to do the right things for it.
Yes, 100%. You can get somebody into a more metabolically balanced lifestyle and they start to decrease their insulin and their insulin resistance starts to improve and the inflammation starts to go down. And granted, I don't usually see changes on labs for about 90 days, but man, really great things happen in those 90 days and things start reversing themselves and things start improving. And that's where I think we really... and it became really evident during the pandemic, like this black and white thinking, and I see that with folks too, who are trying to lose weight or trying to jump on the path or I always say wellness is a journey. It's not a destination, right? Like we're just always on the path, and that path might get, you might get pushed off by some stressful event, or maybe you start drinking too much wine, or maybe whatever it is, like things will start to detour you from your path, but you just got to get back on the path. And none of us are perfect. I certainly am not a purist by any means. I actually pride myself in that. So many people online, all these influencers are so puritanical. And I'm like, I'm just a normal person living out on a farm trying to just stay hot and happy.
Well, and I think that's important because we have friends of ours who are biohackers and things like that. And the lifestyles that they live and that they promote, the vast majority of people can't do that. The vast majority of people are not going to buy a cold tub and put it in their backyard and fill it full of ice and sit in it every day. This is not necessarily realistic for the most of the people. And so for me, the book that I wrote was meant to try to get people where they are. And so there's some followers of mine who are really into their health. And for them, some of the stuff that I give them, like, oh yeah, I can easily intermittent fast for a couple of days a week to help with the process of autophagy. And then there are other people who are like, wow, I drink 4 cans of soda pop a day, and Dr. Youn tells me to start by going down to 2. Like, that's a big win for some people. And if that's the win that you get, that's okay. Life is a journey where you want to go ideally in the right direction. And for me, what I'm trying to do is kind of, nudge people in the right direction. A lot of my followers probably don't even realize a lot of the stuff that's in this book can really impact them. They may not realize that, let's say, deep fried foods are filled with free radicals and that can cause inflammation and cause issues with their health. Like, they may not even get it, So I think it's so important because unfortunately, as we live in this society where it's just, oh, your labs are normal, so you must be healthy. And it's like, no, that's not necessarily the case. How do you actually feel inside? That's a big thing.
Yes. Man, fried food will make you look like garbage, though. That is a truth. Those seed oils in a super oxidized state, bad news. I just think of my poor cells going,
Well, and free radicals, one of the main agers of the skin, and you get a ton of free radicals from ultra processed and deep fried foods. And so limiting that can make a big, big change on your skin. So definitely just one of the super simple tips to get better skin. And that's, I think, one of the reasons why your skin looks so great.
Oh, thank you. Well, I also have good lighting.
that helps too.
You should analyze my skin up close and you tell me. I thank you though. Do you remember when we were young, my daughter had terrible acne. She's an interesting case. she listens to me sometimes and not always. But when she does listen to me, her skin clears up and looks amazing. But my
Yeah.
sister also had terrible acne. The terrible acne kind of skipped me. That's where a lot of those antibiotics came in, actually, was me being vain and, living off of, I don't even know which one I was on forever, but,
Yeah.
trying to keep the acne. That's what they put you on in high school. They would
Yeah.
just pump you full of antibiotics to keep your acne down. But do you remember when it was like, oh, fried foods and chocolate will give you zits? That's about as far
Yeah.
as they took it. And it was
And you know
just
what?
like benzoyl
We know that,
peroxide.
and we know that that's technically true now. I mean, because acne is an inflammatory state. Fried foods that will increase inflammation. Chocolate, dark chocolate's one thing. Milk chocolate, which is, who
Yeah.
ate dark chocolate back in the day? It was all milk chocolate back then. I mean, so
Yep.
there definitely is truth there. And I think, with the antibiotic, it's interesting because I think they look so much at bacteria being a cause of acne. And I'm not a dermatologist, so I don't actively treat acne patients. But there are antibiotics now that people are put on by dermatologists as a way to just ideally reduce inflammation
Yep.
at very, very low levels. And what's causing, but where's the root cause here? What's the inflammation coming from? Well, it's coming from, a lot of it's just basically what you eat.
Yep. Yep. Amen. I agree.
And what's the big inflammation causer? Sugar. So there you go. The first step, you've got acne, reduce the amount of sugar you eat. You can reduce chronic inflammation, reduce glycation. Glycation is a major ager of the skin. Just by reducing the amount of sugar you eat, once again, reduce the amount of sugar sweetened drinks, your skin is definitely going to benefit from that.
Yep. And it doesn't matter what age you are or whether we're talking about acne or not. That is a quick way to make yourself look rough
Yep.
around the edges is,
Oh, yeah. Yeah, especially cystic acne, because that scarring is really, really hard to improve. I
yeah.
get so many patients ask me, I've got this acne scarring, from cystic acne. How can I improve it? And it's like, there's no eraser for it. There's just minor amounts you can improve at a time. It's frustrating.
Yeah, it's tough. And it's really devastating. I think it's a harbinger, though. It's a signal that something
Yeah.
is wrong in the body. That brings us back to that holistic health model of like, it's all the things. Are they sleeping? Are they eating nutritiously? Which I want to ask you about because you talk about in the book eating to nourish. And I thought that was so beautiful. That's always what I try to tell people, like eat nutrient dense food. Stop worrying so much
Yeah.
about this puritanical, like it's so polarizing online. If you don't take a hard stand on nutrition and your nutrition account, well, then you get passed over. But let's talk about that. Let's talk about
Yeah.
eating to nourish. That's such an important point.
So they're actually, if you talk to alternative medicine physicians, they'll tell you that our soil is depleted, that our produce does not have the nutrients that it used to because of industrial farming practices. Is there proof of that, though? Well, there was a study actually performed between 1950 to 1999 looking at the nutrient densities of many different fruits and vegetables. So over 49 years, and they found a statistically significant reduction in the amount of certain key nutrients. Six of them specifically, three of them being the ones that I focus on: vitamin C, protein, and iron. So that's proof. And this study ended in 1999. And that's proof that basically our produce is not as healthy or nutritious as it used to be. And so one of the big things that I am a proponent of is taking nutritional supplements, is obviously really focusing on whole, real foods over, once again, we mentioned the ultra processed foods. And so some of these things can kind of work together. So once again, nutrient density being important. So eating the rainbow of fruits and vegetables, eating, ideally, if you can, I'm a proponent of going organic because there are some studies that show that organic produce does have a higher nutrition profile than non-organic. However, I also understand that some people just can't afford it or don't have it. That's okay. I'd much rather have you eat a conventionally grown apple than, let's say, an organic fruit bar. And so super important to try to stay with those whole foods, those foods that still look like what they were in their real state. It's funny because I grew up in the middle of Michigan. It's a tiny town, middle of Michigan, kind of out in the middle of nowhere. And my parents are first generation. And when I would eat at home, we would eat fish, rice, vegetables, kimchi, garlic, those foods that actually look like what they are.
Yep.
But then I'd go out with my friends and it was all meat and potatoes. It'd be McDonald's and Wendy's and Burger King and Taco Bell and Kentucky Fried Chicken. And a lot of those foods, you could not really tell what they originated. What was their form, their original form? And so one simple thing that I encourage my followers to do is just try to eat more of those foods where you can tell by looking at them where they're from, because that's going to tell you that it's not ultra processed. It's going to have a higher nutrition profile. It's going to overall be better for you.
I agree. I always say, look, how it came off the farm or how God made it, whatever resonates with people, that's it 100%. If it comes in a package and it's got more than 5 ingredients, it's usually not your friend. And I know that's a hard transition for a lot of people to make, but that to me
Hmm.
is like root, you know, that foundation number one. Like that's such a big part. Like start cooking at home. I made a post the other day, something about seed oils. I don't know. Somehow it came up and some lady said, it's just so hard to avoid them. They're in everything. And I'm like, not if you
It's
cook at
hard.
home.
No, yeah, yeah. If you go out, it's in everything, and how can you control? But I agree. Cooking at home and limiting your ingredients, it just makes sense. And I think what a lot of people don't realize is all of that can really show on your skin,
Yeah.
and that's one of the main causes of aging is
Yep.
nutrient depletion and our skin getting thinner, collagen degradation being the other thing. It's kind of hand in hand. Because we're not getting enough protein. We're not getting enough good protein to help with the collagen of our skin.
I agree completely. And that's a hard one for women getting enough protein. I think that I know that I literally just have a hard time getting that much in. But also, I think societally, we've sort of been taught to avoid it. I know that as folks get
Yeah,
older, they tend to eat less and less protein. Their ability to digest it decreases because their stomach acid is decreasing, their stomach lining's atrophying. It's really a really vicious downward cycle. Maybe
limited budget.
yeah, they're on a limited budget. And then to come to find out from Dr. Gabrielle Lyon that you've got to actually eat more protein as you age
Yeah.
because protein muscle or muscle protein synthesis isn't activated unless it gets harder and harder as you age. It's like, oh my goodness, no wonder people start looking so aged.
Well, sarcopenia is obviously a huge issue getting older, the breakdown of muscles and how our muscles get smaller. But the other issue that comes up with that, and I haven't heard her podcast with you yet, is breaking your hip. There
Yeah.
was a study that found that if you're over the age of 50, which, we're kind of in that range, and you break your hip, it's like a 20 to 30% mortality rate if you break your hip within like 12 months.
Oh yeah.
And so, really, as you're looking at longevity, yes, there are some studies, anti-aging studies, that do look at reducing the amount of protein, potentially causing you to have longer lifespans. But when you look at health span and being healthy, being strong, being active, we do need to have enough protein so that we can stay strong and so we can stay active, so we can do those exercises that will help with our fast twitch muscle fibers. So in case you're walking and you trip, you've got the muscles that are working that can help support you so you don't fall and break your hip and then lead to a true mortality event.
Oh yes.
And so definitely protein super important for sarcopenia, for being active as we age. But for those people who are more skin minded, super important for your skin to look healthy and youthful because 70 to 80% of our skin is made of collagen. Collagen is a large protein. And if you're not getting enough protein, you're not going to have enough collagen and your skin will get thinner. There's a reason why women who are in their 70s and 80s sometimes have skin that's so thin, it's
Mm-hmm.
tissue paper thin and even tears from little scratches.
Yep. I always say if you've got to eat collagen to make collagen, and I am with you on the hip fracture. We were taught that day one at chiropractic college that
Yeah.
a hip fracture is the kiss of death, period. I mean, that's it. And whenever anyone asks me why I am so adamant about strength training, I'm like, so I don't break a hip. I mean, that
Yeah.
literally is like goal number one. I just want to have mobile hips that aren't going to fracture on me because it's actually worse in men. The mortality risk goes up so significantly, and it's actually worse in men than it is in women. It's crazy. Like your chances of dying. And actually, what happens is most people end up in the hospital, they get pneumonia and they die of pneumonia. And some of them are so aged and sarcopenic and just completely, I don't know, just kind of falling apart at the seams that they won't even reset the hip. I mean, what a
Oh, geez.
miserable way to go, So eat your protein, lift your weights. There is actually, I don't know if you know about that data, but there's data showing that people who lift weights have much better skin on their face. They look younger. Their face holds its shape better. I was like, yes, 10 points for vanity and strength.
No, I think it's so important because there's a fallacy that walking is all you have to do as you get older. I know that my parents and my in-laws, like, they do a lot of walking and they go, "Oh, I'm exercising, I'm walking." But when you walk, all you're doing is working those muscles that propel you forward, and they're slow twitch muscle fibers. So,
Mm-hmm.
although I think it's a good exercise in general to get your steps in, it's not the same, and that's not going to prevent you from falling. It's not going to allow you to work those muscles that will stabilize you if something happens to you, like you trip. And so I think that we've done a fallacy, unfortunately, in traditional medicine where we talk so much about how walking is so important and that's all you have to do as you get older. It's not. Like you literally are not working the right, all the muscles that you need to. If you can't walk backwards and jump and twist around and things like that, then you're not going to be healthy as you get older. And it's just literally one trip could be the difference between life and death.
Yep. 100%. I completely agree. And if your face is wrinkling and your skin is sagging, your joints look the same inside. It's a
Yeah.
complete connection there. So if your collagen is degrading on your face, it certainly is degrading in your joints.
So we lose about 1% of the thickness of collagen every year, starting in about our mid-20s or so. Now, women, once they go through menopause, they start losing upwards of 2% a year. And that's one reason why, once again, as I mentioned earlier, some women, as they're in their later years, their skin is so tissue paper thin. And so collagen being a protein, super important to eat enough collagen to help to support that. And there's collagen in other parts of our body. So type 1 collagen is in our skin, in our hair, our nails. Type 2 collagen is in the joints. Type 3 is in the muscle. So really we want to make sure that we have a full amount of collagen, because there are some like beauty collagen fiber powders out there that are just type 1.
Yep.
There's some other collagen, supplements that are more of a well-rounded thing, but really you want to understand kind of how all of that works, because collagen is so, so important to the overall staying young and youthful, both on the inside and the outside.
And I think too, a lot of cultures cook in a way that brings a lot of collagen to their food. And that's inherent in the way that they cook and the foods that they eat. And then I think, your typical Caucasian American is not getting a lot of collagen in their foods. They're not eating the cartilage or the bone. I mean, there is the movement towards more bone broth, of course, lately, but in the last few years, but that was really more of a new thing in the past 10 years. Before that, all kinds of viscera or organ meat and collagen foods were pretty much, it was just muscle meat. I was raised on muscle meat. I wasn't raised to eat any of the others.
Yeah. Yeah. And I think, interestingly, because bone broth, there's a lot of our friends who are big proponents of bone broth for skin. Interestingly enough, though, I did do some research to see for the book, are there any studies to support bone broth as actually being beneficial for your skin? Can it improve wrinkles? Can it improve hydration, thickness of the skin? And the answer actually is no. There isn't a single study to show that bone broth is actually good for the skin. But there is not a single study to show that bone broth is not good for the skin. It just hasn't really been tested.
Yeah.
But what has been tested are collagen supplements. Well, that's a hot topic. Collagen supplements, basically you're getting it directly, with bone broth, you're getting it obviously in the form of gelatin. With collagen supplements, you're getting that directly. And there are a ton of studies to show that taking a collagen supplement can definitely benefit your skin.
I agree. I would guess that the bone broth is coming from the musculoskeletal system of the animal, which is probably more that type 2. So I believe it. Well, just anecdotally, clinically, when people drink bone broth, when I put people on like a cup a day, their joints do feel better. So I think you're right. I think we're dealing with potentially different types of collagen. But I know a lot of collagen supplements are made out of animal hide. So I don't know.
Well, and your body's going to break some of that down into peptides and amino acids and some of that, even if it's necessarily collagen that starts off, let's say, in the joints or in the muscle, can that become collagen that ends up, improving the skin? I would think so, but I'm not a scientist, so I can't say for sure. And there's no studies that have told us yet.
Right. I'm sure they'll get there, though. Some company that's selling some collagen will finally get us the answer we need.
Exactly. But it's also important. I'm sorry, but it's also important if you're buying collagen to make sure that you see what types of collagen are in it. So if you have got joint and muscle aches and your, let's say, spouse gives you a beauty-based collagen and that only has type 1 collagen, then that may not be as beneficial as one that has a profile where you've got type 2 and 3 as well.
Yes, totally. I totally agree with you. Okay. We talked a little bit about fried foods accelerating aging, but since we're on the topic of food, what are some other foods that people should look out for that accelerate aging?
Well, the number one thing that I would try to avoid is sugar. So refined carbs. So white bread, white rice, pasta. The issues with sugar mainly, it used to be everybody would say fat is a big problem, but really what we find is that sugar ages our body in two main ways. The first is glycation. So when sugar molecules, they can actually bond to the collagen of our skin, causing the collagen to become damaged. The way I describe our collagen in our skin, it's like the logs of a log cabin. And when we're younger, those logs are nice and tight. they're strong, they're smooth. And as we get older and as the log cabin, ages, essentially, those logs start to fray. The collagen starts to fray. It starts to fall apart. Those tight collagen bundles start to get loose. What sugar does when you ingest sugar is those sugar molecules can actually physically bond to the collagen and the elastin in your skin and cause the collagen to become permanently kinked. That can cause premature aging. And those collagen sugar hybrids are called advanced glycation end products, or AGEs. And so sugar creates these AGEs, very, very appropriately
Yes,
named,
right?
and that will prematurely age your skin. So that's one way that the sugar ages the skin. The second way that sugar ages the skin is something that you have done a really good job in explaining to your followers, is with chronic inflammation. So chronic sugar spikes can cause chronic insulin spikes. Chronic insulin spikes can then lead to chronic inflammation. It can lead to insulin resistance. It can lead to type 2 diabetes, high levels of sugar, all of that being very, very pro-aging, essentially, and causing premature aging of your body. Yep. So the first thing I recommend for anybody who's like, wow, what change should I make in my diet to reduce the aging, the premature aging that's being caused in my skin? It would be to reduce the amount of sugar you eat or drink. And really, there was one study that found that 20% of the calories in the standard American diet comes from sugar-sweetened drinks. Whether it's power drinks, like energy drinks or soda pop or fruit juices, 20% of our calories are essentially empty sugar-filled calories. And if you could take just part of that as a first step and take that out and switch it for a green tea or water or kombucha or something with a healthier level, then you're going to make huge potential changes in your skin. You can see the inflammation reduce in skin. You and I, we have clients and patients where you can tell their lifestyle just by looking at their skin. They come in, their skin is real drab, it is dry, it's wrinkled. You know that they could be a smoker. You can tell when they've got that really overly rosy cheeks that are with inflammation, and the skin's kind of dry and flaky, but they're real rosy, that's inflammation on the inside coming out. These are the types of changes that you can reverse when you make these changes in your diet.
Yes, it's a big one. And alcohol is kind of in there with the sugar. So
yes,
that'll age you faster than anything.
I think so no question, reducing or if not eliminating alcohol from your diet is awesome. The one question that I have, and I still haven't come to a complete conclusion, is drinking 1 glass of red wine a day. Are the antioxidants like resveratrol, the benefits of those antioxidants just may outweigh the alcohol, the toxic effects of the alcohol, but I usually recommend limiting it to 1 glass a day at the most.
Yeah.
For me, I'm a big fan of dry farm wines too, because now you're taking wine that's lower in sugar, doesn't have all the additives, it's organic. And interestingly enough, it's the only wine that I can drink that doesn't make me break out in hives or get a headache the next day or feel real crummy.
Yeah. For the hives, that might be, I did a little research and I started using B6 if I was having that weird histamine reaction to wine, which I know that's not a direct correlation, but it works. Just try it. If you're starting to feel it, just try taking a capsule of B6. Just try it.
Usually I just put the glass down and eventually it goes away.
Well, to offset that. And then obviously some some DAO anti-hist kind of supplements too are helpful. Yeah. But anyway, I digress. Yes, I also think of it as something I don't know if you touched on in the book, but I love this idea of hormesis. And I think of maybe 1 glass a day. I can't drink 1 glass a day. It doesn't make me feel good, but I can drink, maybe 1 or 2 glasses a week. But there is this idea of these little hormetic hits, and hormesis, for the audience listening who doesn't know, it's these little doses of stress that cause your body to respond in favor. And it's actually, you end up better off than you started. And so like strength training to me is a hormetic hit, and small incremental doses, not chronic stress. Chronic stress will age the heck out of you. But I do think of alcohol sometimes as that little hormetic hit. So I don't know.
Yeah.
That's just
I think that we look at that even in skincare. There's a difference between acute inflammation and chronic inflammation. And acute inflammation can actually be very anti-aging. So for example, if we, let's say, do a laser treatment, that creates acute inflammation of the skin. And the collagen, those fibers that are starting to fall apart, those log cabin, when you do an acute inflammatory process to the skin, as long as it's not overdone and you create scar, then that collagen, as it heals, it's going to heal in a tighter fashion. So virtually all the skin tightening treatments, the non-invasive or minimally invasive ones act in some ways off of that whole principle, where you create an acute controlled trauma, let's say to the skin, and the skin actually will heal in a younger fashion afterwards. It's just when it's too much that you can develop, once again, scarring. So whether it's a laser doing it with light energy, or a chemical peel doing it with an acid, or even microneedling, where you make literally a poke in the skin, that trauma, the skin will actually respond by causing the collagen to become thicker and healthier and more youthful.
That's the whole premise behind the
Yes.
needling work I did with
Yep.
prolotherapy and regenerative injections. Like, it's not just inject PRP into a joint. Like, you actually needle the compromised enthesis of the ligament and tendon, because you're trying to do exactly what you just said. You're trying to evoke collagen synthesis and production, because you're causing it to bleed and you're giving it a controlled inflammatory impact.
And we can do that now. We even take it to the next level, where we have treatments like Morpheus 8, where you make the needle poke, and then and that needle itself is actually insulated all the way up to the tip, but the tip emits a radio frequency energy or heat, essentially. So now you're getting the double benefit, where you get the trauma from the needle and then the heat that heats the deeper skin. When the skin is heated to a certain temperature, that collagen denatures, and once again it tightens up again. And so, there are these ways now where we can, it used to be you would make microneedling, just started by making the little needle pokes, and it was just the trauma that you get the benefit from. And some people still do that. It's a good bang for your buck because it's not that expensive. The next step up, what we used to do, and we still do, is apply the PRP over the skin. And so you've got those little needle pokes. You have these tiny channels then that go to the deeper skin. You put the PRP, the platelet-rich plasma, on the surface of the skin. And that platelet-rich plasma, you basically draw from your own blood. It's filled with growth factors. And those tiny holes will allow those growth factors to seep into the skin, rejuvenating the skin from the inside out. And now we've taken it to the next level with Morpheus 8, where you make the poke and now you heat the deep skin. And if you want, you can apply PRP on the surface of it after that too.
I need that. That's amazing. I wonder, do these come in longer needles? Can we inject them into joints? Because that sounds amazing. That would heal stuff up so amazingly well.
Purely cosmetic, so I don't know whether you could do that. You don't want me giving advice there.
Man, the original prolotherapy was Hippocrates. He heated hot pokers. He would stick hot pokers into people's shoulders to contracture their capsule when they had lax capsules and were dealing with joint dislocation. He'd hit them with a hot poker in the joint, and that was the OG regenerative medicine. So you're kind of gone. It's kind of gone full circle. I love this. I'm going to come see you and have my face heated and tightened up. I love that.
I do it right here. I do it to my neck.
Oh man, that's starting to get me. It's this,
that's what I do.
The gaggle, or whatever we call it. I know, I'm starting to look like my mother. My mother's a beautiful woman. I can't say anything, but it's happening. So, okay, cool. I love this. Real quick, since we're talking about food, what are your thoughts on intermittent fasting? And
so I am a big fan of it, I think, from an anti-aging standpoint. Now, obviously, there's, everybody talks about different ways to do it for weight loss and metabolic health and all that. When you look at it purely from an anti-aging perspective, this is something that we actually tested. We have a 3-week jumpstart in my book, where we basically took patients or people, we put them through this jumpstart for 3 weeks, where we focused on 4 things: what they ate, when they ate, supplements, and skincare products. And for 3 weeks, we put them on this. Week 1, it was just essentially cleaning up their diet, getting them the nutrient-rich foods, getting rid of the ultra-processed foods, the added sugars, alcohol, gluten, and dairy. And then weeks 2 and 3, we actually had them intermittent fast just for 2 days each week, where they would do a fast from 8 p.m. until noon the next day. And the main thing that we are looking for getting is autophagy. So a huge benefit of fasting essentially is what I call intracellular cleanup, where as our cells, as we are basically the act of being alive, our cells will develop intracellular waste products. And these are waste products of like organelles and proteins and even kind of used up mitochondria. And in order for our cells to essentially clean themselves out, they have to undergo this process called autophagy, where it's basically your body using that intracellular waste for energy. When it uses the intracellular waste for energy, it helps to clean the cells out. The cells will then function more effectively and more youthfully. And essentially, that's what we want to see, essentially this cleaning out effect. But unfortunately, autophagy cannot happen if you're constantly eating. And that's one of the problems with our society, is that we don't take breaks from eating. And some reports say that you need to stop eating for a minimum of about 12 hours for autophagy to truly kick in and for it to really recycle this intracellular waste. And so what I recommend is for people to start, even with, if you've never fasted before, just starting with a 12-hour fast, 8 p.m. to 8 a.m. the next day. It's usually not that hard. Give your body and your gut a time to rest, and that can be very beneficial for an anti-aging perspective. Ideally, if you can even go 16 hours, so that 8 p.m. you stop, you don't eat until the next day at noon, then that gives you even more time for autophagy to essentially work. Now, we actually took this one step further too. There are some information that I have found that does state that certain types of foods can also help promote autophagy, possibly even when you're actually eating, because we think about autophagy happening when you're not eating at all, but can you actually stimulate autophagy while you're eating? And it turns out if you're eating healthy fats, like omega-3 rich fatty acid foods, like cold water fish, like tuna, trout, salmon, mackerel, that type of thing, or monounsaturated fats like olives, olive oil, avocados, nuts, and seeds, that group of foods, as well as polyphenol rich foods, which are foods that typically are like brightly colored fruits and vegetables like strawberries, blackberries, blueberries, and dark vegetables like green leafy vegetables and like black beans and stuff like that. If you eat those types of foods, you may be able to then break your fast at noon, eat those types of foods, which is kind of like a healthy keto diet for the rest of the day, and you may be able to stimulate that autophagy process to continue much, much longer.
That's awesome.
And so we tested this for 3 weeks on people and found these fantastic results. Now, it's not a facelift. They didn't look like they had a facelift afterwards. But we had people that would literally stop them on the street. Random strangers would stop these people on the street and go, hey, just have to ask you, what are you doing with your skin? Because your skin looks so nice. Or we'd have people that would go to parties and their friends, not knowing that they were doing this 3-week jumpstart, would stop them and go, yeah, you just look really, really good. And I can't really put my finger on what it is. And so it was really cool because in 3 weeks, people really turned everything around in a very short period of time.
That's amazing. That's really cool to hear. And I mean, that's proof positive to nourish yourself correctly and do the right things. And like you said, sometimes you need the supplemental help and the right skincare. That's testament. That's so, I'm going to use this. And if I have a party or something I have to go to or an event,
There you go.
I'm going to be pulling out the book, getting my 3-week jumpstart on. That reminds me of back when I was younger, they would, in the, not health magazine. Well, they were kind of like women's health. I don't even really consider that a health magazine, but you know what I'm talking about. And they would be like, 3 days to beat the bloat before you're big, squeeze into the dress or whatever. But in this case, this is a good 3 weeks.
It's like, just eat grapefruit for 3 days and you're going to be great. Oh, geez.
And then you'll pass out at the party. Yes. Okay. Anything? Oh, skincare. Let's talk. I saw you talking on a video about the 2 things that you need in your skincare lineup, 2 of which I'm not doing. So let's cover those and talk a little bit about skincare before we close up.
Yeah, so one thing that we did is we actually tested people on a very simple skincare routine because it's so confusing. You go to Sephora, you go to Ulta, you go to the department store, and there's so many products out there. How do we simplify it to a skincare routine that anybody can do that really works for them? And this is it. So we tested it on people for about 2 months. We found it takes literally 2 minutes a day. And after testing on people for 2 months, we actually put their photos online. We asked people, how much younger do they look? And they looked an average of about 5 years younger. So the skincare routine, very simple. You wake up in the morning, you cleanse your skin with the cleanser appropriate for your skin type. So if you've got oily skin, you want to use ideally a foaming cleanser. If you've got sensitive skin or real dry skin, then a hydrating or milky cleanser is better. Then you want to apply an antioxidant serum. The most common antioxidant serum is vitamin C, and most skincare companies have a good vitamin C serum. A little biohack, though, is there was a study that found that if you combine vitamin C and vitamin E, you can get a synergistic antioxidant effect. And so ideally, if you have one that combines vitamin C and E, that would be best. We have one called the CE antioxidant serum. There's a real famous one by SkinCeuticals called CE Ferulic, but it's like crazy expensive. And so a vitamin C serum, ideally combined with vitamin E in the morning. And then I do recommend the sunscreen. I know that you've talked about your skin cancer journey. Like I think most things, there are dermatologists who will say, put on sunscreen, even if you're going to be sitting in a dark room in the basement all day. And then we have some of our holistic friends who are like, I don't apply sunscreen. I'll just put lard on my face and that's it. Well, you've dealt with skin cancer. Yeah. I have seen patients who come in with basal cell cancer, where they look, there's a little dot on their nose and they go and get Mohs surgery. They come back and half their nostril is gone. Yeah. And so you do not want to get a skin cancer on your face. Yeah. Period. I mean, you just don't. And so I am definitely a fan of sunscreen. I do recommend avoiding 2 ingredients, oxybenzone and octinoxate. because they are potential hormone disruptors. In general, if you can go with a more mineral-based sunscreen like a zinc oxide or titanium dioxide, that's good. But those can cause your skin to look overly light, and especially if you're a person of color, that may not work so well.
Right.
And so if you're going to go with a chemical sunscreen, then look for avobenzone or Mexoryl XL. Those are in general safe. They're not considered hormone disruptors, and they won't make your skin look whitish, give it a whitish hue. So that's all you have to do in the morning.
Okay.
Cleanse, antioxidant serum like vitamin C and E, and then ideally apply sunscreen if you're going to be out in the sun that day.
Okay.
At night, super important. You got to cleanse your skin. You got to get rid of the day's worth of grime, dirt, oil, and buildup. Some people will double cleanse, especially if you're wearing makeup during the day. A lot of people recommend an oil-based cleanser, and that's one of the things I sent to you, actually. You start with an oil-based cleanser to get the makeup off, and then you do a regular cleanse after that. After you cleanse your skin, then I recommend an anti-aging treatment. And the most common one is retinol. Retinol is a derivative of vitamin A. It is found in a lot of different skincare lines use retinol. It is probably the most scientifically proven anti-aging ingredient there is. Now, prescription strength retinol is Retin-A. And there have been multiple studies showing that Retin-A can reverse fine lines. It can thicken the dermis, or the deeper layer of the skin. It can reduce unwanted pigmentation, and it can even reverse early pre-skin cancers.
Wow.
But that's with the prescription strength. Retinol is over-the-counter strength. Prescription strength, you got to go to a doctor to get. Retinol, you can get virtually anywhere. You can get it online. We have my own retinol moisturizer. I think I sent one of those to you. Retinol is much easier to tolerate, and the reason why it's not prescription strength is because it goes on your skin inactive, but then it converts, your skin will actually convert it to the tretinoin, which is the active component, essentially.
Okay.
And really, that's all you have to do at night. Cleanse your skin, use a retinol. If you can't tolerate retinol, if you've got real sensitive skin, then go with bakuchiol. Bakuchiol is a plant-based alternative to retinol, where there was a head-to-head study comparing the two and found bakuchiol had the same effects as retinol for anti-aging, but with less skin irritation.
Okay.
And that's all you have to do at night. If you want to apply a moisturizer on top of that, if you're in a real dry climate, if it's in the wintertime, feel free to do that, but it's not necessary with everybody. And then the final thing, Tina, is that 2 or 3 times a week, if you've got normal skin, to exfoliate your skin. Once a week if you've got sensitive skin. Exfoliating your skin either with a gentle scrub or with a alpha hydroxy acid type of a peel, that can help to get rid of that upper layer of dead skin cells. And that actually sends a cellular signal to the deeper layer of skin cells to cause those cells to turn over more quickly. And that's one of the things that happens as we get older, is that our cells kind of build up. They don't turn over as quickly, and we want to get that process revved up.
That's been huge for me. Like just getting that dead layer off the top. I never had to scrub before, and now I do use a scrub, or I do use some acids, and it helps so much to just keep, again, it's that collagen.
Just don't overdo it.
Yes, don't overdo it. I did overdo it, and I gave myself little capillary ruptures, and I was oh no, that's not good.
Yeah, it used to be too, we would use these alcohol-based astringents, and you put that on your skin. It feels nice and clean afterwards, squeaky clean. But what we know now is that there's actually a microbiome on our skin, just like the microbiome in our gut. Obviously, it's different bacteria, but we are learning more and more that the microbiome on our skin, like our gut microbiome, contains a lot of functions to keep our skin nice and healthy. And so, overly doing, let's say, exfoliation, using alcohol-based astringents and things like that can really disrupt that microbiome. And you want to leave that microbiome alone and leave that skin barrier function nice and healthy.
Yes, I agree. Don't overdo it. We like when I stopped trying to strip all the oil off my face got much nicer and much happier, and it quit overproducing oil. I was that kid that had very oily skin, and I was that, it was, what were those terrible wipes we all use? Clearasil Clearasil was a big one. The pads. Those Oxy pads too. Oh yeah, terrible. And I would just get more and more oily. So yes, especially as we age, ladies, we don't want to be stripping our oil off our face. So I love all these ideas. And what happens when you strip that oil off is that your skin sees that there's not oil there, and it starts to create more oil. And so you get this kind of negative feedback loop where cleaning the oil off, stripping it causes more oil to come, and then you strip that, and you're just in this terrible cycle that you can get into. That was me for decades. I was just oil producing all the time because I was stripping it so much. I will say I have started wearing a zinc-based sunscreen because I'm actually paying attention to my face now. So You'd be proud of me.
Yes. I mean, if it takes vanity to get you to wear your sunscreen on your face, then that is fine. The fear of having a disfiguring skin cancer, if that's what it takes. I mean, I honestly, I fear for one of my favorite actors, Hugh Jackman, because he's had multiple skin cancers removed. He's such a good looking guy.
Yeah.
He's so talented. And it's scary. Like you just get one like on your eyelid or on your nose or something. And I mean, it's just, it can be so, so scary. So
Oh, yeah, I know you're hitting my heart with that one. I had a melanoma scare recently and it turned out to
yeah,
be
I know.
benign, but like that was
Yeah.
so terrifying. And I have baked the crap out of my back, especially as a young person. And again, it's these things you can't take back. You know, I fell asleep on
No.
shoot, numerous times I fried my back, but yeah, you can't take back those sunburns.
Yeah, what I would recommend if you can would be, I mean, there's retinol moisturizers that some people have for the body, and that might be something just worthwhile using. I mean, it's anti-aging, but if you've got a history of a cellular atypia
Yeah.
in your skin cells, you never know what it might reverse, but there are studies that show that prescription strength definitely can reverse early cancers, skin cancers. You just don't, the fact is they just don't show up. So you don't know what it's done. But
Yeah.
I think it's worth a try, especially, when you've had your skin cancer scares and stuff. You want to do everything you can. Other than, traditional medicine is so reactive of like, oh, when you get it, then let's treat it. Well, isn't there a way that we could try to prevent that from happening? And I think that's one of the things that I would look at. Obviously, preventative being the sunblock, but can you actually reverse some of those atypia cells that you don't know about yet? It may be possible using a topical retinol.
Yeah, I agree. That's great. I had never thought of doing that, but that I have read that. I went on the big skin cancer deep dive
Yeah.
research path when the melanoma showed up. So, yeah. I have a question about retinol. They say if you use retinol at night, you can't go out in the sun in the morning. I have also read that you can if it's been over 14 hours. I've read all different kinds of things. What are your thoughts on someone like a woman my age? A lot of women my age are using retinol moisturizers at night. What are your thoughts about us getting or sun exposure during the day?
I think you'll see if you do use it, you'll know when your skin is being sensitive to it,
Okay.
essentially. So let's say if you're going to go on a vacation to the Caribbean or something like that, then I would discontinue it 1 to 2 weeks before you go on a heavy sun vacation. But if you're just going out and you're doing some gardening or doing some sports or something like that, in general, obviously, if it's going to be real sunny, you want to wear your sunscreen anyway, but you'll feel it in your skin in general. That sensitivity is not something that's in general just going to pop up out of nowhere of like, oh my gosh, I got all these burns or something. You're going to feel your skin being more sensitive to it. And so in general, I would just say to wear the sun protection, but not worry so much about it unless you're going to have a lot of like significant exposure.
Okay. And would you suggest, is there any concern? Some ladies like to put it on in the morning, and then those are the ones who don't want to go out in the sun. And I would think putting it on at night, like you suggest, makes more sense and washing it off in the morning.
Yeah, actually, in general, the sunlight will deactivate the retinol. And so you're
That's
kind of
okay.
wasting your money on it. So in the morning, you want to use an antioxidant. That's why vitamin C you should use in the morning, because
Okay.
that's going to actually help protect you even from the rays of the sun. The antioxidant is going to protect you because it's going to fight the free radicals, one of the main agents of the skin. When you look at the sun and the UV damage, it damages your skin by creating free radicals and by creating inflammation. Okay. And so there is a belief that obviously by eating the right foods, the rainbow fruits and vegetables, as well as applying that antioxidant rich substances to your skin can help protect you from the sun as well. It's not necessarily a substitute for actual, a sunscreen. It's not going to be that powerful, but it can definitely help because it can reduce that oxidative process.
Okay. That's very helpful.
So
That's
yeah,
awesome.
vitamin C morning, retinol at night. You don't want to switch them, and no reason to use vitamin C at night because you're sleeping. There's nothing to really protect your skin from because it's dark.
Right.
And then retinol will get deactivated by the sunlight, so now you're wasting your money.
That's what I remember reading is it gets deactivated. It's deactivated within a certain amount of time. So blah, blah, blah. And I was like, this
Yeah.
is so confusing. And then my best friend and I were kind of going around in circles about it because she used to work for Lancome and she's like, no, you
Mm.
can't. She always wears a hat. And I'm like, get sun on your face. And I got to say this. She and I have been best friends since we were in sixth grade. She has been religious about sunscreen, religious.
Good. Yeah.
And I have been completely just slacking on it, just
Yeah.
out baking the crap out of my skin. And while I wouldn't even say though, I don't have way more sunspots than she does. I know we have different genetics and we're different humans, but her skin does not look remarkably younger than mine by any means. So I think it's interesting. Just at the end of the day, I always told her, I'm like, if we both live to our 50s and 60s, this is like the ultimate competition of who ends up. But I think I embraced healthy food a lot earlier than she
Yeah.
did. So I
Well, and
think there's that too.
I do think that some of the spots that we develop are coming from when we're much younger, because I do
Yeah.
have a lot of patients of mine who they come in, they've got tons of age spots, sunspots, age spots, liver spots, they're all different names for the same thing. And it's UV damage causing the melanin to kind of clump. And I see a lot of people, they'll say, look, I don't get hardly any sun, but where are these spots coming from? And I do believe it's from sun damage from long ago that finally kind of rears its ugly head.
Yeah.
And so when you're in your 20s, you may bounce back very quickly, but you don't know whether you're going to pay the price later on, because some of that damage can once again rear its ugly head later on when the cells start to actually become atypical and you get potential skin cancer issues and stuff like you're dealing with.
Well, and I wonder how much in the way of seed oils we were all sucking down. I think that
I mean, a lot. That was back when people said margarine is like good for you. Like have as much. My dad was a physician, and I remember it back then. My mom got margarine for us, and I was putting a ton of it on my toast. And my mom asked my dad, like, "Is that okay for him to eat that much margarine?" He goes, "Oh yeah, margarine's healthy, as much as you want on there." And I'm like, "Oh, okay."
Yep, I know. We
Oh,
were
we know
bathing
differently
in it.
now.
I know.
Yes.
I know. I remember when butter left my household and then I
Yeah.
brought it back. I brought it back to my parents. I'm like, throw this crap away. I can't believe it's not butter garbage. And funny story. I don't know if you've ever heard this of my story, but when I met my husband in 2019, we had a date after several dates and I spent the night at his house and I woke up in the morning. He went to work and I looked in his fridge and I can't believe it's not butter. And I texted my friend and I was like, I got to break up with him. I can't
That's
do
what we
this.
had in my house. Yeah. When I grew up, that's what we had for
Yep.
like over a decade was I can't believe it's not butter.
Yep.
Yeah.
I was going to just end it right there. I was going to cut it off and come to find out it was his adult son who also lived in the house. It was his butter. He didn't know better. And my husband had
unforgivable offense.
Well, the current he turned into my husband. He ended up being my husband, but he had a brick of Amish butter because we live out in Amish country, out in the drawer. And I was like, okay, you're redeemed. He had Folgers coffee, and I can't believe it's not butter. And I was like, I don't know if I can do this.
An Eskimo pie in the freezer, right?
To a Klondike bar, right?
Yeah. Oh, it's funny. My wife and we had a Klondike bar. This was a few years ago, and we were at some party, and we each had one, and it was so funny because about 45 minutes later, I look at her and she looks at me and she's like, "Are you crashing right now?" I'm like, "I so am crashing. Are you crashing?" She's like, "I'm totally crashing." And it was crazy having the exact same time. And like, we've not had one of those since then. We're like, oh my gosh, the sugar in this is insane.
We used to live off those and just go play all day, right?
I used to live off of Wendy's Frosties, and then I go home and eat like bibimbap. It's like crazy.
Well, at least it sounds like you had some pretty good traditional food in your home. That's great. I was like, I was the Midwestern girl that was eating all the processed. Bless my mom, she tried, but I don't know. The first time I had broccoli, it was frozen with that gross cheese sauce. It wasn't I was like, and then the first time I had real broccoli after that, just like, a nice steamed crisp broccoli, I thought, this is the same thing? This is crazy. This can't be the same thing I've been growing up on. So anyway, well, Tony, this has been so fun. Is there anything we haven't talked about in the book that you want listeners to leave with?
No, I think what it is it's an anti-aging guide, a step-by-step guide to turning back the clock using your body's own regenerative abilities. So it's what you eat, when you eat, supplements, skincare products, and then I go over all the different non-invasive and minimally invasive options, including red light therapy. We talk about Botox and fillers and all that type of stuff, although that's very much on the side because I really believe that anybody can look 10 years younger just by making these little changes in their body, in their diet and in their lifestyle and all of that, because your body does have innate regenerative abilities. You just need to know how to actually tackle that and how to give your body the ability to do it on your own.
Amen. I'm with you 100% on that. I love it. I didn't read through that part. I want to know more about this Morpheus 8. So is that in there too, or is that just
Yeah,
a
so
special
the
thing in your
last part of the
clinic?
book literally goes through every single anti-aging or every single aging issue that you may have with your face and what are the non-invasive or minimally invasive options. So talk about
Awesome.
excess skin, the eyelids, crow's feet, nasolabial folds, frown lines, droopy skin, jowls, and what are non-invasive or minimally invasive options to treat those if available. So it's kind of the step-by-step holistic guide. Plus, if you want to take that next step to do some treatments, some of them you could easily do at home, or other ones, if you have access to a doctor's office, then these are options for you. And we even talk about natural ways to thicken the hair, to whiten your teeth, all these different options that, I mean, that I think a lot of people don't realize that you can do a lot of this just at home and not spend a ton of money, yet see actual results.
I'm going to read it and I'm going to beautify and I'm going to come back and you're going to let
Everybody's
me
going
know
to
how I
accuse you of
did.
having plastic surgery. I'm like, no, no, I just auto-juvenated myself. That's all. It's not plastic surgery.
Oh, people accuse me of all kinds of nonsense constantly, so it's okay.
Well, me too.
I love it. Where can everyone find you? You're obviously a TikTok sensation and Instagram
Oh, thank you.
king. So
So I'm
go there, guys.
all over social media. If you actually, if you do order the book, I have a website, autojuvenation.com, autojuvenation.com. It's spelled just like it says. And we do have a ton of free gifts if you do order the book, including a companion recipe book, including $30 to my online store, younbeauty.com, where we sell skincare and supplements, and a whole lot of other goodies, even a quick start skincare guide just to get you started. So it's at autojuvenation.com if you pick up the book.
Okay. And this podcast will launch when the book is out. So everybody will be able to grab it. Is there a place you want to send them for that? Amazon? Is that the.
You can go really, for me, I try to encourage people to go with their local independent bookstores. And so there's a website a lot of people don't know about called bookshop.org, where you can choose your actual local bookstore. And if you buy the book there, they will actually send the profits to your local bookstore and they'll mail it to you.
That's
So
awesome.
that's where I try to push people to, because I mean, there's so many independent bookstores that just would love your business. So it's very simple, bookshop.org. You choose your actual bookstore. They have a list of all these independent bookstores, and then the profit of that sale goes to them.
Okay, that's fantastic. I did
Yeah.
not know. I live in a small town and we have a little bookshop here. So I,
That it might be there. So instead of getting your books on Amazon, Tina, then try bookshop.org and then see if you can choose that bookstore, and they'll get, even if they don't have it in stock, like they'll mail it actually from bookshop.org and then share the profit with your actual bookstore.
so cool. Okay,
Yeah.
very good to know. I'm glad you shared that with my listeners because that I bet a lot of people here will appreciate that. Okay, well, we will make sure all the links are in the show notes as always. This has been a total delight. I'm so glad we finally
Oh,
got to
thank you.
connect.
Yeah,
Thank
this is a lot of fun.
Yeah, thank you for all of your insight. I learned a lot, and I'm gonna try it. We're gonna see if Tina can auto-juvenate,
All
and
right.
we got to get rid of the
She hasn't
gels.
had plastic surgery, everybody. It's auto-juvenation, not plastic surgery.
I'll give you all the credit. Okay, thanks for coming on the show.
Thank you.